When it comes to adhesives and cementation, there's a good reason why so many dentists prefer universal products. They simplify things. Universal products simplify your inventory, and they reduce the number of products you need to familiarize yourself with. Unfortunately, some universal products are not as universal as their makers claim, working markedly better in some clinical situations than in others. This is not the case with G-CEM LinkForce from GC America. G-CEM LinkForce is a dual-cure adhesive resin cement that gives you a universal, strong, and aesthetic solution for all adhesive challenges. It's one solution that fits all clinical situations without any compromises. What does this mean for your practice? It means that you can confidently use G-CEM LinkForce with a wide variety of indications and substrates. This includes traditional crowns and bridges, long-span bridges, veneers, and CAD/CAM restorations. G-CEM LinkForce works well with everything from composites, hybrid ceramics and traditional ceramics, to alumina, non-precious and precious metals, glass fiber posts, and lithium disilicate. It even works well with zirconia. G-CEM LinkForce provides excellent and stable adhesion in all situations. This chart illustrates its tensile bond strength to 4 different substrates before and after thermocycling. G-CEM LinkForce's bond strength outperforms most competitive products in most situations, including when used to bond to dentin, gold alloy, porcelain, Emax, and hybrid ceramics, such as GC America's CeraSmart. Thanks to the MDP monomers in G-Multi-Primer, a product that is used in conjunction with G-CEM LinkForce, stable adhesion to zirconia can be achieved as well. Plus, whether you use G-CEM LinkForce in light cure or self-cure mode, you'll get a reliable bond and excellent flexural strength as well, which is good news for those clinical situations that cannot always be reached with light, such as luting prefabricated posts, cast post and core, and zirconia crowns. G-CEM LinkForce is available in 4 shades to cover all of your clinical needs: translucent, A2, opaque, and bleach, with corresponding try-in pastes available for your more demanding cases. All 4 shades give you tooth-like fluorescence and high color stability over time for long-lasting aesthetic results. G-CEM LinkForce also has a homogeneously dispersed, ultra-fine hybrid filler and a high 62% filler rate. This results in very high polishability, significantly less buildup of marginal plaque, and excellent wear resistance. G-CEM LinkForce performs synergistically with G-Premio Bond and G-Multi-Primer. G-Premio Bond is for bonding to all tooth preparations and is applied directly to the tooth. G-Multi-Primer is for bonding to all restorations and is applied to the inside of the restoration. G-CEM LinkForce goes between these 2 products, providing strength and aesthetics for all cementation procedures. Here's how the cementation technique for inlays, onlays, crowns, and bridges works. First, as with any indirect restoration, you'll want to do a trial fit. Remove the temporary restoration and clean it thoroughly. Check the fit and occlusion. If necessary, use the G-CEM LinkForce try-in paste. Once you're satisfied with the fit, remove the restoration and rinse it with water. Next, you'll prepare the restoration according to the manufacturer's instructions. For glass ceramics, this means etching with hydrofluoric acid, rinsing, and drying. For other restorations, this means sandblasting and then blowing clean with an air syringe before rinsing and drying. Regardless of the material, once the restoration is rinsed and dried, you'll apply the G-Multi-Primer and dry it with an air syringe. Next, prepare the tooth surface. Rinse and dry the prepared tooth and then etch, rinse, and dry. If you wish to use light cure mode, apply G-Premio Bond straight from the bottle. For dual cure mode, Mix the G-Premio bond in a 1:1 ratio with the G-Premio bond dual cure activator. Once the G-Premio bond is properly cured, it's time for the actual cementation. Extrude G-CEM LinkForce directly into the restoration and then immediately seat it onto the prepared tooth or abutment, maintaining moderate pressure. While continuing to maintain moderate pressure, remove any excess cement. The excess can be tack cured for 1 to 2 seconds for easier removal. Then either light cure each surface or margin for 20 seconds, or, if you're using self-cure mode, let the restoration set for 4 minutes. Finally, finish and polish the margins as necessary. As you can see, with G-CEM LinkForce from GC America, you get a dual cure adhesive resin for cementation of all types of indirect restorations. Used in a cementation system in conjunction with G-Premio Bond and G-Multi Primer, it provides both strength and aesthetics in one solution that fits all clinical situations and adhesive challenges without compromises, giving your patients the strong aesthetic results they deserve.